Each year, nearly 700,000 children are victims of abuse and neglect, and parents struggle under the weight of their own childhood adversity, mental health needs, financial stress, and isolation. 50 years ago, a few volunteers decided to help by creating what is now KVC Health Systems, and ever since, we've been on a journey to find the best research-backed ways to help children and families. This is our story. In 1970, a woman named Ellen McCarthy noticed boys who were staying in a juvenile detention center but didn't belong there. These children were neglected, abused, or homeless. She organized a group of women from the Junior League of Wyandotte and Johnson counties, and they created Wyandotte House in Kansas City, Kansas. We soon added 2 more houses for children. Wyandotte House became Kaw Valley Center, then simply KVC. In 1980, Wayne Sims became KVC's president and CEO, beginning a successful 35-year tenure. Sims and his team led with inspiring values, prompting KVC team members to seek the best interests of children and families by asking themselves, what would you want for your child? Seeing that many children needed mental health treatment, KVC raised funds to open a children's psychiatric hospital in Kansas City in 1987. In the 1990s, the Joint Commission accredited KVC, giving it a gold seal for safety and quality. Then, in 1996, when the state of Kansas decided to use private nonprofits to strengthen foster care, it chose KVC as a lead provider. We helped Kansas achieve national leadership in outcomes like children's safety, caring for more children in family homes rather than institutional settings, and reducing children's time in foster care. In the early 2000s, word of KVC's incredible results helped us grow into West Virginia, Kentucky, and Nebraska, providing child welfare and mental health services. We also raised funds to house our administrative team and opened the Ball Conference Center, named for Fred and Joanne Ball. The Balls have been instrumental for decades, with generations serving on the board and securing philanthropic support. Since 2010, KVC has opened 2 more children's psychiatric hospitals in Kansas. We also merged with Niles, a Missouri leader in children's behavioral health for 135 years. KVC deepened its expertise in trauma-informed care and neuroscience-based treatment, and created the KVC Institute. Child welfare agencies around the world, from Washington, D.C. to Singapore, have asked KVC to teach them best practices. As KVC celebrates 50 years, we reflect on how a few friends and their acts of kindness in 1970 have impacted hundreds of thousands of children and families. We all need connection, whether to a caring friend or professionals, and the heart of our work is helping people. How will you help us today to realize KVC's vision of a world in which every child is safe and connected to a strong family and a healthy community? Join us.